Good morning. If you have decided to study and you want to become a professional hypnotherapist, keep watching our training videos about clinical hypnosis. Hypnotherapy is an effective technique with which you can help and improve the quality of life of a great number of your future patients. Remember, read the description of this video where you can find a link to free training classes on clinical hypnosis, and also you can download several ebooks also free. The information in this video is extracted from our book Direct Clinical Hypnosis, Deep Hypnosis, of our publisher Clinical Hypnotherapy, registered with ISBN. Direct Clinical Hypnosis, Suicide Treatment, Part 3. In the face of completed suicide, try to cover the psychological needs of the family and help to overcome the feelings of guilt. To take care of the family members so that suicide by imitation does not occur. Bear in mind that suicide is often frowned upon by many members of society. We must work on this point. Death is not our greatest loss. Our greatest loss is what dies inside us. Emotion of suffering in survivors. Depression, disbelief, loneliness, sadness, confusion, rejection, insensitivity, abandonment, shame, guilt, fright, helplessness, grief, denial, anger, stress, despair, anxiety. Self-esteem fails in 100% of people, sometime in their lives. It is called the glass leg of psychopathology, because self-esteem is very easily broken. Maladjustments is proportional to age. The older you get, the more likely you are to have maladaptive behaviors. Psychological balance rests on two legs: self-esteem and adaptation. Self-esteem would be the glass leg, as it breaks very easily. The Western model is based on repression, and this is the number one enemy of self-esteem. The more repression, the less self-esteem. If there's a good capacity to adapt, everything will be fine. If there is not a good adaptation, distress arises, and as a consequence, an imbalance appears on psychological level. Of course, all this leads to pathology. Poor mental health does not arise from the psychological imbalance itself, but from the degree to which the pathology restricts the quality of life of the sufferer. If it restricts, if there is a mental health deficit, if it does not restrict, there is psychological health. Being aware of our own emotions helps to relativize them, giving them the importance they deserve, and also to enjoy them. Enjoying our positive emotions in moderation and being able to put all of them in context, both those that give us pleasure and those that are painful, is the goal of any psychological technique to improve the human being. For the Eastern civilization, balance occurs when the two opposing forces that contain everything that exists are leveled, yin and yang. The Chinese define illness as an imbalance between yin and yang. These forces form a dynamic equilibrium, because when one increases, the other decreases, producing an imbalance. Yin is associated with tranquility, gentleness, night, darkness, water, sleep, spirituality, water, sleep, the spiritual, the moon, thought. While yang has to do with the sun, strength, waking, light, fire, rational action, and excess of yin would be linked to loneliness, depression, sadness, nocturnalism. A person with high yin would be shy, low profile, introvert, prudent. On the contrary, an abundance of yang would cause anxiety, stress, neurotic behavior, and hyperactivity. People with yang predominance would be extrovert, communicative, and are noticeable for better or worse. Balanced people combine both factors. They can be cheerful or sad according to circumstances. They seek friendship, tranquility, live in peace, and above all, they do not lose their calm. They accept both day and night and enjoy the sun and a good moonlight night. They are prudent in critical moments and bold if necessary. Balance occurs when the two opposing forces that contain all that exists are balanced, yin and yang. If you're interested in learning more about clinical hypnosis, watch our next video, Direct Clinical Hypnosis, Tips for Maintaining Emotional Balance, Part 1. Remember, read the description of this video where you can find a link to free training classes on clinical hypnosis, and also you can download some ebooks also free. If you have any questions, add them in the comments area. On this topic and many others we will talk about in the channel and in the videos that we'll publish. So, if you're interested, do not miss our next videos. Thank you very much.